Welcome to Unit 1.3, Construction of Hypotheses and Types of Diagnosis. In this class, we will learn how, from clinical findings, we can generate, classify, and prioritize diagnostic hypotheses at the first contact with the patient. The objective of this unit is that you will be able to formulate and prioritize differential diagnoses, classifying them as probable, possible, or definitive. Clinical reasoning begins with the symptoms reported by the patient, but the key step is to integrate that data into clinical problems. For example, the isolated symptom cough has little value, but if accompanied by fever and crackles, we can establish a clinical problem such as pneumonia. There are different types of diagnosis in medicine, each with a specific purpose: clinical, differential, syndromic, topographic, etiological, prognostic, probable, possible, and definitive. The clinical diagnosis, also called presumptive, is formulated from history and physical examination. The differential diagnosis, on the other hand, is a list of hypotheses that we must analyze to identify which best explains the findings. For example, in the case of headache, we may think of migraine, meningitis, or subarachnoid hemorrhage. The syndromic diagnosis groups data that together form a syndrome, such as meningeal syndrome. The topographic diagnosis focuses on locating the lesion, such as a spinal cord lesion at C5, C6. The etiological diagnosis identifies the cause, for example, bacterial meningitis by Neisseria meningitidis. The prognostic diagnosis seeks to anticipate the evolution, favorable, guarded, or severe. Another way to classify diagnostic hypotheses is by degree of certainty. Probable, when it best explains the current findings. Possible, when it is less compatible but should not be excluded. And definitive, when confirmed with studies or objective criteria. Example: chest pain. Acute coronary syndrome is probable, reflux is possible, and a myocardial infarction confirmed with troponins as definitive diagnosis. To generate differential diagnoses, we can rely on three approaches: anatomical, asking where the problem is; physiological, what function is failing; and etiological, using mnemonics such as VINDICATE. One of the most useful strategies to avoid forgetting important causes in the differential diagnosis is the mnemonic VINDICATE. Each letter corresponds to an etiological category that must be considered in the presence of any symptom. V is vascular, such as a cerebral infarction or a pulmonary embolism. I is infectious or inflammatory, such as pneumonia or meningitis. N is neoplastic, such as a bronchogenic carcinoma or a lymphoma. D is degenerative or deficiency, such as Alzheimer's disease or vitamin B12 deficiency. The second I reminds us of iatrogenic or intoxications, such as drug-induced hepatotoxicity. C is congenital, such as congenital heart disease or cystic fibrosis. A is autoimmune or allergic, such as lupus or asthma. T is traumatic, such as a fracture or traumatic brain injury. And finally, E for endocrine or metabolic, such as diabetes or hypothyroidism. This tool allows us to broaden our view and ensure that we explore all relevant diagnostic possibilities. Not all differential diagnoses carry the same weight. That is why we must prioritize them considering three criteria: probability, severity, and treatability. In some cases, we have standardized diagnostic criteria, such as those of the American Diabetes Association, the Jones criteria for rheumatic fever, or the Rome criteria for functional gastrointestinal disorders. These criteria reduce subjectivity and increase certainty. Finally, there are diagnoses by exclusion. These are made only after ruling out all other possibilities, as occurs in chronic fatigue syndrome. In conclusion, at the first clinical contact, the physician must generate diagnostic hypotheses, prioritize them, and organize them. Complementary studies, which we will see in Unit 1.4, will be used to confirm, rule out, or redefine these hypotheses. Remember, a good clinician knows what to look for even before ordering a study.